Welcome to Conversations Live. For more than a decade, we've brought you the best in books, entertainment, celebrity interviews, and current events. When the movers and shakers of the world have something to say to you, they say it to us first. Here's your host, Cyrus Webb.
And welcome back, everyone, to Conversations Live. I'm your host, Cyrus Webb. Glad you all could join us once again. But for our radio audience here in Mississippi at WYAD 94.1 FM and WYADonline.com, we're glad that you all could be with us. Also, tuning into our friends at iHeartRadio and Amazon Music Podcast, we're glad you all could be with us as well. As you guys know, during the month of June, not only we're celebrating Men's Health Month, but also giving you guys some great information that hopefully you can use for yourself and share with your family and friends. We're excited to welcome Dr. John Kaspar to our program today. He's going to talk to us about something we probably have heard about, that being enlarged prostate or BPH. We're going to talk to him not only about the impact it can have on life, but also the results of a recent survey by Teleflex Incorporated that looks at about 1,000 men and some of the issues that they talked about, but also how UroLift is something that can be able to help when it comes to dealing with the issue of BPH as well. Dr. Kaspar, thank you so much for the time. Really appreciate it.
Thank you, Cyrus. Appreciate you having me today.
Well, this is one of those things, Dr. Kaspar, that is not always exciting to talk about, but it is definitely a necessary conversation. As I mentioned in my intro, a lot of us have heard about enlarged prostate or BPH. Let's start there. What exactly is BPH, Dr. Kaspar, and what are some of the symptoms that come along with it?
Sure, that's a great question, and you're right, it affects a lot of men. BPH stands for benign prostate hyperplasia, which is the normal growth of the prostate. So the prostate is a walnut-sized organ that sits below the bladder and in the urethra in men. Okay, that organ continues to grow for the rest of our lives, about 2 to 5% per year. And as it grows, it can crimp off the urethra and cause symptoms of urinary frequency, urgency, slow stream, hard to get started, getting up many times at night. So this is an organ that impacts almost 12 million men with those type of symptoms. And by age 50, it affects 50% of men. By 70, it's almost 80% of men. And by age 80, 90% of men.
Wow, that is something. And as I mentioned, there was a recent survey, Dr. Kaspar, done by Teleflex Incorporated. Talk to us about some of the findings there and what it reveals, not only about the side effects, but also the impact that BPH is having on men.
Absolutely. I mean, there is such a huge impact in quality of life in these men. Just think about what they do. They want to avoid social interactions. Why? Because they're mapping out bathrooms. They have that sudden urge, I have to go. So almost 45% of men avoided these events because of their urinary symptoms. They're, like I said, mapping out restrooms. When they're at home or they go out to these social situations, they're staying close to the bathroom because of that sudden need to go. They're also wearing different clothes. They're wearing darker colored pants because they don't want to see any stained urine on their clothes, which can be avoided. The biggest thing that happens is the interruption of sleep. About 70% of men are so fatigued the next day that it's difficult to concentrate, it's difficult to function, because they can be getting up 2, 3, 4 times at night. And about 25% of these men are sleeping in a separate bedroom so they don't wake up their partner during their bouts to going to the bathroom.
Well, and I think this is some of the things we don't think about, Dr. Kaspar, when it comes to the impact it can have. It's not just a condition, but also the impact on other parts of life. I mentioned, though, that there is help, UroLift system. Talk to us about it and exactly how it's different from other treatments and even medication that's out there.
Sure. The UroLift system is a minimally invasive procedure that can be done in an ambulatory setting to help relieve the symptoms of frequency, urgency, and nighttime bathroom use. It has no cutting, no heating, and no removal of tissue. It's the only procedure that preserves sexual function and can be rapidly done and has been proven to be minimally invasive. It's an alternative to the standard, which is medications. Medications have significant side effects which can cause dizziness, headaches, stuffy nose, and affect sexual function. So we can do these minimally invasive procedures such as the UroLift system to help avoid the side effects of medications, and yet we don't have to do a larger procedure like the TURP or TURP procedure that most guys are afraid of. Minimal side effects, like I said, from this procedure. There have been over 350,000 men who've been treated with the UroLift system worldwide, and it's accepted by the European Urological Association as well as the American Urological Association.
Dr. Kaspar, I didn't mention it in my introduction, but you're a urologist, so these are conversations that you're used to having with your patients. I think the big thing that we can tell our audience is we're not only, of course, having this conversation, but thinking about June being Men's Health Month is, one, hopefully they are seeing a doctor, and two, that they're having these conversations with their doctors. So if some of our audience members are experiencing some of the symptoms that were the findings of the survey that Teleflex did, why is BPH treatment important that they talk about with their doctor, as well as ways that they can look at things like the UroLift system for themselves?
Right. Well, because, men are notorious for avoiding interactions with their physicians. They don't want to go to the doctor, and they don't want to tell really the whole story about their symptoms.
Yeah.
If they let this go, this could really impact not only their quality of life, what we say, but bladder function. The bladder is a muscle that sits right behind the prostate that's working hard and can affect their bladder, and can permanently affect their bladder where they may have to catheterize themselves for the rest of their lives. So it's important to get an early start and preserve their bladder function.
This is such an important conversation, Dr. Kaspar, and I'm so glad that we have you here to talk to us about it. Again, everyone, Dr. John Kaspar has been our guest. He's a urologist, talking with us not only about what BPH is and the impact it can have on your quality of life, but also the findings of a survey conducted by Teleflex Incorporated that looked at approximately 1,000 men and what they were dealing with when it came to urinary symptoms that are common with BPH, but also the impact that UroLift system can have on men and to be able to help them in dealing with this. So, Dr. Kaspar, where can our audience go for more information?
You can go to urolift.com, and on that website you'll see a symptom checker, which is a little questionnaire to evaluate where you stand. Are your symptoms minimal, moderate, or severe? As well as you can also see a physician locator in your area to help with this problem.
Dr. Kaspar, thank you so much for the work that you do, as well as being a part of our coverage here during Men's Health Month, and looking forward to having you back on the program again.
Thank you, Cyrus. I appreciate your time and help with this.
Hey, the pleasure is definitely all ours, and we thank your audience for tuning in to another great segment of Conversations Live, part of our News You Can Use segment here at WYAD 94.1 FM and WYADonline.com. Until next time, I'm your host, Cyrus Webb, saying, as always, enjoy your day, enjoy your life, enjoy your world. Thank you all for choosing Conversations Live, and let's go make today amazing. Take care.